Hi there, welcome to this little introduction about the Allergy postgraduate program at Imperial. My name is Dr. Marta Vazques-Ortiz and I'm the program director, and I'm a consultant in pediatric allergy at Imperial NHS. So why to choose our program? So Imperial is a great institution, very well reputed, and it's one of the top 20 universities worldwide. And I believe very much the excellence in clinical practice and research and in education is very much the feature of allergy at Imperial as well. And this tradition goes back many, many decades. And it was at Imperial at St. Mary's Hospital where Noonan Freeman developed aeroallergy and immunotherapy for the first time in 1911 and published in the Lancet about it. And then two very prominent figures in the allergy field as well globally were based at what is now NHLI and Imperial. And it's two people who left us recently, sadly, Dr. Brill Frankland, who ran one of the first clinical allergy services in the country and partly the world, and led the first clinical trial in immunotherapy. And then Professor Barry Kay, again at Imperial, who did a fantastic contribution to our understanding of asthma mechanisms, T2 inflammation and eosinophils. And it's in this context that we're very lucky to have this array of fantastic clinicians, academics and educators at Imperial. And the pictures here, probably, if you're a bit into the allergy field, you probably recognize quite a few of these faces. These are our module leads, and mainly the teaching you have access to in our program is really world-class experts. So our own faculty, as well as the international network of experts we work with and we have access with, who are heavily involved with the program. We have a really extensive syllabus covering all aspects of allergy, from the immune mechanisms to the latest in terms of diagnosis and management strategies. It's very much a proactive, student-centered, blended learning approach. So lots of learning by doing and putting things into practice. And it's a very flexible program. Many of our students are full-time working professionals, and a very international flair in terms of the faculty as well as the student community. So this is the structure of the program. So we have 3 levels, and you can choose if you want to just do, say, postgraduate certificate, or whether you want to progress into diploma or MSc. So the first step will be to do postgraduate certificate, and everybody starts at that level. And as you see, we have a year divided into 3 terms. And in the first year, you will be doing 3 modules. They're all compulsory modules. So the scientific basis of allergy, where we go about the pathophysiology of allergy, lots about immune mechanisms and how this relates to the clinical presentation, diagnosis and management. Then you have a very clinical module, diagnosis and treatment of allergic disease, very practical, very popular. And then last that year, the cutting edge of allergy. So all the latest developments in the allergy field with relevant for clinical practice of future research, and also helping you develop key research skills to develop your critical appraisal skills going forward, to be lifelong learners, as well as to develop your own research projects going forward, particularly if you want to continue with us and do the full MSc. So that's postgraduate certificates. And then you might want to continue and do the second year modules, and that will give you a diploma. And the second year modules are in depth to different disease areas within allergy. So you see food hypersensitivity, rhinitis, rhinosinusitis and immunotherapy, asthma and allergic disease, allergic skin disease, and pediatric allergy. So in much more depth, covering the whole spectrum, more complex scenarios, the latest in terms of diagnosis and treatment in a quite specific way. So lots about allergy. And then you might choose to do the MSc, which is the above, plus a research project, which is generally an original research project you can do either with us at Imperial or in your local institution with local as well as Imperial supervision. You can also do a systematic review, but people find original research generally also very rewarding. So this is the structure. And this is how the teaching is. Our teaching method is blended, which means that there are on-campus elements as well as online elements. And having learned throughout the COVID pandemic and also with the new pedagogies in postgraduate education, there are two components. So there's an asynchronous component where there are a range of materials for students to access in their own time, including lectures, mini lectures, reading lists, web links, and tasks to work on. And then again, a range of synchronous activities. So when we get together, either for online sessions or on campus sessions, and there's a lot of interaction, and as I said, a lot of discussion and learning by doing, both in the online as well as on the on-campus live elements. You see there lots of case-based discussions, workshops, role-play, simulation, hands-on practical sessions, student-led work, lots and lots of group work and debates and interesting presentations as well. And this is how our module sort of looks like. So we launch the module through a webinar. So we say, you know, this is what the module is about, all the materials available, what the expectation is, what tasks students need to work on. In week 3, we do a warm-up online session to get started with some of the key concepts around the module. And then usually on week 4, we do the main teaching week, where we have online elements towards the beginning of the week, as well as on-campus elements generally towards the end of the week. And then say around week 8 and 9, there is the assessment for that particular module. So this is how some of our on-campus sessions looks like. So as you see, lots of hands-on stuff and practice. And the assessments cover a range of areas. It's authentic assessments, so things that many of us in our professional career will need to develop those skills and put that into practice. So things like case reports, running an allergy clinic, writing a research grant application, or presenting a poster or an oral abstract, patients' leaflets, review papers, etc. And who are our students who comes to the program? So our program is very much suitable for healthcare professionals as well as biomedical scientists and industry professionals, really wanting to know the latest in allergies to become experts in allergy. And in terms of healthcare professionals, we generally have doctors with a range of backgrounds, so pediatricians, general practitioners, allergists in training, dermatologists, chest physicians, ENT, gastroenterologists, specialist nurses, very, very important, and always a really nice group of students that we have. Dietitians also working or willing to work in the field of allergy. And as I said, also non-healthcare professionals such as scientists or industry professionals. You can read some testimonials from our students on our website. And this is just a snapshot of what we've had in the last cohort. So quite a few home students, European students as well as overseas. And you see a selection of the countries here. So just thinking about research opportunities, so I was saying, you know, kind of the background in the institution, and of course, doing the allergy MSc can give you a wealth of research opportunities from our academics and of course beyond. And the main areas where Imperial Allergy is strong is asthma, so covering mechanisms, diagnostic therapeutics, and quite a lot of interest in preschool with difficult and severe asthma. Food allergy and anaphylaxis, the mechanisms, the epidemiology and diagnostics, and allergen-specific immunotherapy, both for food as well as inhalant allergens, where there is a huge tradition. And then the early origins of asthma and allergic disease, and that covers clinical research as well as wet lab and dry lab research, and the artificial intelligence team is really strong, working with some of our academics in that field. So opportunities for research in all these areas. And then in terms of the clinical services that contribute to the education and that you have access to, so it's mainly the teams at Imperial NHS, so mainly based at St Mary's as well as Chelsea and Westminster Hospital, mainly for gastroenterology, and the teams at the Royal Brompton Hospital. And it is really, you know, tertiary, quaternary services with fantastic experience for many decades in dealing with a really complex disease. So this is an example of our pediatric allergy service, and we've been recognized recently as a World Allergy Organization Center of Excellence. So one of the biggest tertiary services in Europe, but very much a multidisciplinary approach with doctors, nurses, dietitians, speech and language psychologists, working very much, very close to all the specialists like dermatology, gastroenterology, respiratory medicine, ENT, general pediatrics. We see a lot of children per year with a focus on complex patients, holistic care, and patients' education. We have trainees from a range of backgrounds, and we are the lead for North West London network. So we work in partnership with primary, secondary care to ensure seamless care across the sector. Strong evidence-based practice and lots of opportunities for translation and research for our patients. So this is, kind of the philosophy, of course, and this is what our clinicians as well bring to the program. So the wealth of expertise in managing patients with complex allergic disease. And then in terms of career opportunities for the students, of course, and many of our students are healthcare professionals really willing to develop their career in the field of allergy, so and get a more specialized clinical role within allergy, and that can be within a big, say, tertiary service and have a prominent role within that multidisciplinary team, or very often is much more in a secondary care or even primary care role where they become the lead clinician dealing with allergy and developing a service around them and networking within the region, of course, and beyond, thanks to the learning and the networking opportunities that the program allows them to develop. Of course, research opportunities. Some of our students go in to do MDs or PhDs, and some become PIs in their own institutions. And then, of course, job opportunities or career progression opportunities for other professionals. We've had students go into lead allergy nurse role or senior research fellow roles, etc. And then industry colleagues who've had job opportunities or career progression opportunities, such as clinical research physicians or medical advisors, or even more senior position with kind of more decision-making ability within the company. And I hope that gives you a bit of a snapshot of what the allergy program is about. And please go to our website for more information, and feel free to drop us a line and email if you have any queries. So thanks so much for listening. Bye.